viewers, today we are going to discuss about a common burning topic, that is dengue fever in children. And I know it is a common question for all parents, what to do, what is dengue fever, what can you do, how to prevent it. So let us discuss about dengue fever in details a bit. So dengue, you all know that is a viral disease which is transmitted by mosquitoes. And once your mosquito bites, the dengue symptoms starts after 5 to 7 days of incubation period. So dengue fever has 3 phases. Initially, it starts with a febrile phase associated with nausea, vomiting, body ache, headache, etc. And sometimes children presents with irritability, crying, particularly smaller children, where they cannot express their pain or their restlessness. Along with that, sometimes dengue fever comes with rashes, that is called common dengue rash. After initial 4 to 5 days, when fever comes down, then the critical phase starts. So critical phase remains for around 48 to 72 hours post febrile phase. And remember that not all dengue fever goes into critical phase, but we should be very careful and vigilant during this critical phase, where the fever comes down, but other complications of dengue can appear. So what are the complications or what are the warning signs you should know? So warning sign means can be severe abdominal pain, excessive vomiting or nausea. There will be bleeding manifestation or mucosal bleeding, or there can be simple restlessness. Children can present with irritability, restlessness, or sometimes adolescents or older children complain about dizziness. So can be a manifestation of low blood pressure also. Sometimes dengue goes into severe dengue, or we usually classify as a severe dengue with shock. So they present with either hypotension, severe bleeding, or any organ dysfunction. So WHO 2009 classified dengue into three types of dengue. One is dengue fever with warning sign, as I discussed earlier, and another is severe dengue. So obviously dengue fever with warning signs and severe dengue requires close monitoring and hospitalization strictly. And sometimes they managed in critical care unit only. They cannot be managed in pediatric ward also. Let us discuss about what is the management and how will you treat dengue. So as you all know that dengue is a viral fever, so there is no specific antidote for dengue. But whatever we do is a supportive treatment. What you can do at home, definitely plenty of oral fluid and rest at home. That is most important. And for fever, we should give paracetamol only. Should not give ibuprofen or other non-steroidal anti-inflammatory drugs for treating fever, because sometimes they can present with bleeding manifestation in dengue. And if fever is not coming down, which is very common, you can go for tepid sponging. So just do sponging with lukewarm water or skin temperature water, and keeps on doing sponging till the fever comes down. Along with that, you should give all supportive treatment, all kind of water you can give. ORS or oral rehydration solution is best treatment, but sometimes babies do not tolerate ORS, so we can give some home-based rehydration therapy like coconut water, dal water, sometimes puffed rice with sugar and water you can give. So home-based remedies or clear soups also acts as a home-based rehydration therapy. So those are main mode of treatment for dengue. But remember, if they present with warning sign, as I discussed earlier, they need hospitalization and close monitoring and blood test in daily basis kind of. So obviously we should prevent from mosquito bites. Those diagnosed cases of dengue patients, they should be in mosquito net, under the mosquito net, and because if mosquito bites them, they can spread dengue to the other family members also. There is no vaccination till now for dengue, but probably some workers are on phase 3, phase 4 trials, so we may get few dengue vaccines in next few months. If you have dengue fever with warning sign or severe dengue, definitely they need hospitalization, and obviously severe dengue needs intensive care unit treatment. Dengue fever with warning sign, usually we admit the child and give IV intravenous fluid along with some supportive treatment, and definitely we monitor a daily basis, that is packed cell volume and platelet count. But if they have features of severe dengue, like dengue with severe hemorrhage or shock or other organ dysfunction, they need intensive care unit management. There is no specific treatment for dengue as I told earlier, but definitely all organ support system is required, and strict ICU monitoring is very essential. Sometimes they need respiratory support, sometimes they need IV albumin kind of things, but overall dengue, severe dengue needs intensive care management. So first of all, don't panic. So obviously dengue can be severe, but not all dengue can be severe. So first of all, don't panic. Don't give over-the-counter antibiotics for dengue, because it is not going to help your child, rather it will harm. Don't give any other antibiotics than paracetamol, that is very important. You should give plenty of oral fluid, and obviously ORS is the best, but other home-based rehydration therapy can be given. And if any warning sign, as I discussed earlier, you should consult your pediatrician, because they may need hospitalization. And those with minor form of dengue can be managed at home, but at least keep them under mosquito net or protected, so that mosquito cannot bite them and cannot spread dengue to the other family members. And obviously, last but not the least, and I think government also is promoting this kind of things, that obviously you should look into the households and surroundings, that there should be any stagnated water, because there is a breeding place for mosquitoes. Thank you.